Minimally invasive cardiac surgery is growing as the expertise across the world grows with the technologies that we are using to support those treatments. Now, to give you an idea of what keyhole heart surgery really means, first we have to understand how we normally perform heart surgery. Traditionally, this is performed by opening the breastbone. This is a very good way to do heart surgery. It gives the surgeon very good exposure. We can repair, replace heart valves, we can do bypass grafts, we can treat heart rhythm disturbances, we can do many treatments through there. But more recently, as technology has advanced and expertise has grown, we've been able to access the heart to deliver exactly the same treatment strategies but without breaking the breastbone. Instead, what we do is sneak between the ribs, either on the right hand side or the left hand side, to approach the particular area of interest within the heart that needs to be corrected. Now, in the right patients with the right level of expertise, we know that those patients will recover quickly because these smaller incisions are not only cosmetically more appealing, they heal so much quicker. So a small cut around the nipple on the right hand side to repair a heart valve in a man will heal in 7 or 8 days. And we know from recent randomized trial data done in the United Kingdom that at 4 weeks, those patients who've had their surgery performed through the keyhole will recover so much quicker than those equivalent patients who are randomized into the breastbone group. So in summary, what we're really saying with keyhole heart surgery is that if you're suitable in the right expertise, we will be able to allow you to recover so much quicker with less pain, less risk of infection, less risk of bleeding, and a much swifter recovery back to your normal life than if we had opened your breastbone for the same treatment.